Hi, Heather and Corey. Thanks for having us this afternoon. I'm happy to be here today to introduce some of the unsung heroes of our department through this whole COVID pandemic. And these are three of the members of the Gloucester Health Department's contact tracing team. They're three very experienced nurses. Well, Kelly's a little bit newer, but getting more experienced by the day. And they are dedicated to their profession. These nurses work with us every morning. We talk at 8:45. Silvia and Cindy are our nurse leads who assign the tasks for the day and the cases and follow up on any problems. But they go way, way beyond all the time, making sure that their patients and cases have everything they need, they feel supported, and they have the resources. So I'm going to let them do the talking today because they're amazing. And thank you guys for being here. I'll introduce them. We have Silvia Vanderberg, who is a nurse at the Gloucester Public Schools, but is also working with the health department as one of our nurse supervisors for the team. And we have Cindy Junker, who tried to retire after leaving the Gloucester Public Schools, but she's now working with us as well as the other supervisor. So we have a 7-day-a-week coverage. And then Cally Tibert has joined us more recently. Cally's a recent nurse graduate, and Cally is filling the role as our agency business outreach nurse, contact tracer. So she works with any larger businesses or agencies if they're having problems or need help.
Let's say there is, last weekend there was a family party, 12 people were there, and there was an exposure. Can you could one of you begin with what happens then?
So what happens is a person goes to be tested, and we suggest, sometimes they get an antigen test, which is a rapid test, and then we suggest that they follow up with a PCR, which is a longer test, but is more accurate. So once the testing comes back and it is received by the Department of Public Health in Boston, it comes to us electronically, and then we begin the investigation of the case. So what usually happens is we call the person and we ask to speak with them about a recent test that they've had. And then we ask them if we are the first person to notify them of their positive test. And then we give them information. We give them information about what is quarantine or isolation. If they are the index case, they're the positive case, then they are in isolation. And isolation lasts for 10 days. We send them a written document that talks about how you can isolate from people in your family, how you need to take care of yourself in that period of time. We also offer them food if they don't have a way to get any food. We have the open door that can deliver groceries or can deliver hot meals to them. We offer them a thermometer if they are symptomatic and need to take their temperature. We can bring them that. We can bring them cleaning supplies such as Clorox wipes from our office. We've done that for people who can't get out, and if they're having to share their home with other people in their family, then they're going to want to wipe down surfaces in the shared areas such as the bathroom, etc. We tell them to stay away as much as possible from the rest of their family members so that they don't infect the rest of the family if they're not already a case. Of course, those people are considered close contacts, and a close contact is a person who has been exposed to a positive case within 48 hours of the test, and then within 6 feet for at least 15 minutes over a 24-hour period of time. Sounds a little confusing, but that's how you do.
So within 6 feet for at least a 15-minute period of time.
Over 24 hours.
24 hours. So it could be just once for 15 minutes over 24
Exactly. Or it could be 2 times at 8 minutes apiece. For the 48 hours prior to the onset of symptoms or their positive test. So from that point to the point that you're telling them that they're positive. Anyone who's been in contact with them, a close contact, would then have to be put in quarantine for 14 days from their last exposure to the positive case.
And is quarantine different than isolation?
Well, it is, but you still can't go out in the public. So you need to stay home, and you need to follow the orders that we send. We send a written document, usually via an email. We'll just say information on it if they give us an email address, and then we send the written information. We could also have it taken to their house if they need us to do that. Or we could, usually by mail would take too long. So we either take it there or we email it to them. So they have it in writing and can refer to the information if they didn't quite understand it the first time. We also give them our phone numbers so that if they have any questions or concerns during their isolation or quarantine period, they can reach out to us and we can answer questions for them, or we can solve problems for them. We can then get them food if at first they didn't accept food from the open door or groceries, then we can bring that to them. Or if they suddenly decide they need a thermometer, or they need cleaning supplies, or they need something else, or they need someone to make a pharmacy run for them, we can also do that for them as well. So we are here to support them and teach them how to best get through this isolation period of 10 days.
Silvia, I wanted to ask, why is it that the schools have done such a great job up to this point compared to other sectors of the community?
Well, the reason for it is because basically we're not just having a meeting, as nurses, at the Department of Health. We also have the school nurses have a meeting every day at 1 o'clock religiously. And we discussed, if somebody has a possible symptoms, we put them on a special line list in that it's only visible to the nurses, obviously, not anybody else. But we know if somebody has a symptom, we automatically tell them, please go home, set up a test. We give them a possible testing site where they can go to have tested. And then we tell them, not to come back until actually we figure it out what's going on. It could be maybe some allergies to the season, but then the doctor could say, okay, we did the COVID test, it's negative. You maybe just have an allergy. You can go back to school. So we won't allow people to come back to school, students to come back to school if they have symptoms. And we are following through every day with every one of our students when they have these symptoms, basically. And we know who's there, who's not there, why not there, why they're not coming. So we have a communication every day. And I think that's why we're successful, because we also have a wonderful seating charts for every student. We know where they are in what part of the day. It doesn't matter if it's at 8 in the morning or 10 in later on. So with that, we know who would be the close contacts for them, so we can reach out to them if we have any issues. So I think the organization is pretty good right now, that we are really on top of every case that possibly could come up. And because we work together as the Department of Health and the school, we know if somebody was a close contact or somebody was a positive, we immediately reach out to the school liaison at the schools, which is Jeff Parker or me at this point, the two of us. And we are immediately, it doesn't matter if it's a weekend, a Saturday or Sunday, we reach out and then we find out who the close contacts were, where the seating arrangements were, so we can contact them so they do not go back to school on Monday. So we're preventing them to actually go to school without not knowing, because sometimes that is the case. We just need to make sure that we reach everybody in a timely fashion. So I think with the cooperation between the two departments, I think it's working wonderfully. So that's all I can say about that. So,
Cally, tell us about working with businesses when there's an exposure in a business. Is there a different process?
So basically we reach out to when we hear that there's a contact working for the business, we reach out to the business itself, and then we can't really give them the name, but we just say there has been a positive case in your place of work, And then we get a line list of close contacts of people who worked on those days. And then we do the same kind of thing that Cindy explained earlier with that contact tracing and making sure those close contacts get tested and quarantined for 14 days. And then we also just let the businesses know about the importance of following all these protocols for their safety and for the other staff safety as well.
Well, I was just going to ask, how worried are you all with Thanksgiving on the horizon?
Yeah, I mean, I think we worry about the movement of virus back into the community from mainly college students returning. You know, college students do tend to move around, they tend to pass the virus, and they're not really at risk themselves, but as they come back to a Thanksgiving dinner with older members of their family, they're, you know, putting people at risk. So we've started to talk about as a team, and here at the health department, some outreach, some public outreach to people about really planning carefully for the return of college students, but also just for holidays in general. The governor has also issued some guidance on that, and it's important people follow it. So we'll see how it goes. No, did you guys want to add to that? How worried are we, team? They don't worry, they're calm. They
So how much of a challenge is it finding the people who have been exposed? Are you finding that that's really difficult, or are people more generous with the information?
So it depends. Sometimes people are forthcoming. We explain why we're trying to reach the people, and it's not punitive. It's just so that we don't spread the disease around the community any more than it's already been. I feel that we've done a great job of people responding to us as community members. I think they trust us more than if it were someone who they didn't know or they weren't familiar with. And sometimes the positive case themselves will identify their close contacts and let them know that we're going to be calling them. So it's not like, oh, I didn't realize I was a close contact. So most of the time, they already know that they were a close contact of a positive case, and then we just follow up with them and follow through with them. We do suggest that if you are a close contact, that you do have a test yourself within your quarantine period. The CDC hasn't really told us what is the best date. I don't think they really know. You don't want to get tested on day one, because if you were just exposed yesterday, you're probably not going to have a positive test by day one, but they usually say by day 4 or 5, so you could leave your house to go and get a test done, and then you would go back home. And regardless, if you get a positive, or a negative test during your quarantine as a close contact, you still have to stay in for the 14 days. And the reason for that is that your incubation period for COVID-19 is between 2 and 14 days. We've had people that have turned positive on the 14th day. They begin having symptoms and then got tested. And some people are even asymptomatic. And that's why they don't understand, why do I have to be here in my house when I don't have any symptoms whatsoever? And we have to explain that you are still able to spread the disease, because that's the way it is.
Karin, I want to press a little bit harder on why this works, why contact tracing works, and why this is so important to do.
Right, because COVID is a highly infectious disease, so and it needs a human host, so it can't keep spreading if it doesn't have another person. There can be a small amount of transition on objects, but we're learning that that's a much smaller piece of the transmission. It's really about infectious people who are spreading it to another live person. So the idea of the contact tracing is, as soon as we possibly can know that there is someone who could be spreading the virus, we want to get them completely isolated. And I think part of the success of this team is that they go above and beyond all the time, checking up with people, figuring out what other supports they need, whether it's mental health support, grief counseling, food, medicine. And we've had some people, we've had some really kind of special clients in the past year that maybe didn't connect with one of these guys, and then we try a different nurse or a different member of our team to see if we can get a connection. And they've been really successful at that. I think, they spend the time with people to figure out what they need to be able to isolate and stay home, and have what they need at home. And then that contact piece, I think, again, Gloucester does an extraordinary job in following up on each and every contact. So everyone that's identified as a close contact, and we've double checked it with if it, was the school or an agency, we've double checked that we got everybody. We're really very, very thorough on reaching all of those people and keeping those people who are potential spreaders for 14 days away from the public. So, I think it's a credit to the education, the time, the personalities of the team, and the way they work. Can you guys say, what's your secret? What's your magic? What else?
Well, I want to just add to that. It's got to be particularly alarming, and Cally, maybe you could respond, when we're talking about employment and telling someone they can't go to work anymore. I mean, and particularly if they feel well and they need a paycheck, that's got to be tricky. And you're working in that space. So do you want to talk a little bit about that?
Well, I think that's like part of what the first thing that I talk about with a business is that they don't have an option. They have to, it's CDC, Massachusetts Board of Health guidelines that they need to stay home, and it's really for their best interest. And we also do offer some financial information assistance, and if they need that during the initial interview of a contact or a case.
And I cut you off. I'm sorry, Karin. I just wanted to jump in on that question. But do you guys want to respond to what your special magic is?
I think, sometimes sense of humor helps, and basically just being patient. And if it doesn't work, then to find somebody else who may have a different way of, talking to another person. Because sometimes we do have that difficulty that we don't go on the same wavelength with the person that you're talking to, in contact tracing. And then you have to realize that, okay, I can't succeed. Let's have somebody else to try it. And then 99.9% of the time, it works very nicely, that there is another person who could actually reach him that you couldn't do. So I think sense of humor is definitely a helpful, because it breaks the ice, half the time. So for me, at least,
I also think that if you listen to them and let them vent, then you can kind of get them to understand what you're asking of them, and that you are not the person who has created these guidelines. You're just the person who's helping to inform them and make sure that they follow these guidelines to the best of their ability, so that we can minimize the spread of COVID-19.
And lastly, did 70+ degrees in November freak you out, or was that a good thing that people are going to air their places out?
I think it's best. Let's have more of that weather.
I agree.
Yeah, for sure.
Well, we appreciate all of your work and what you're doing for the community, and we appreciate your time. And we would love to check in with all of you again, as obviously the days grow shorter and the months grow colder. So thanks once again, and congratulations for all the work you're doing. It feels as though it's really working.
Thank you.
Thank you.
Yeah.
Thanks, guys.
All right. Thanks for being with us.
Have a good day.
Thanks all.
Bye-bye. Thank you.
So Heather, I also, before we leave, wanted to give a little quick shout out to what's going on tonight. There's a short documentary about the outdoor mural at Ocean Crest at Neptune's Harvest. You know where that is, at the end of Commercial Street?
I do, yeah.
In Gloucester, right? And it celebrates the legacy of local fish workers. And so tonight on Awesome Gloucester's Facebook page, they're showing that short documentary. And then it's going to be followed by a public Zoom discussion. So we'll have that link for you right here in the text. And they have awesome images from Cape Ann Museum too. So we just want to give a shout out to the folks at Awesome Gloucester, the museum, and everyone else who got involved in that. That is tonight at 6. And if you haven't checked out that mural, go down to Commercial Street. It's pretty cool stuff. See you tomorrow.